Welcome. Dr. Todd Smith, internal medicine physician here in Princeton, West Virginia. And I am so happy that you have decided to listen to some of these videos. These videos are my thoughts on how to restore healthcare in America. There's a multitude of videos that we are going to be doing, and these videos are going to be geared to thinking outside of the box for a change, trying to rethink how we have access, affordability for healthcare in America. And we can do this. I'm determined. This video is the first video, and the reason why is because a lot of other videos I think are going to tie in with this. And this is going to address the provider payments. What we as providers charge the patient, insurance companies, Medicare for our services. There are a lot of problems with this, and so let's just jump right into it. One of the biggest problems that I have is that my training in medicine, 4 years of medical school, 3 years of internal medicine training, and during that time, really no effort was spent on how to bill patients and how to code on the billing. It's a little bit better now, but still minimal. My training was on diagnosing and treating. That is what I'm supposed to do. Yet, whenever I came out in practice, I realized, oh brother, I've got to be able to accurately code and bill for my services. Does that make any sense? When I started in 2000, I had a very simplified form. That form actually has, I was looking for it, but it had two sides, front and a back. And with that, I really didn't even need that much. But with that, I was able to document what I did in the room, document what the patient came in with, document my treatment plans and my diagnosis, or what I thought was the diagnosis for the patient. Simple. I was able to do that in a room, and I was able to listen to the patient. Now, look at your chart notes. And a lot of people can now look at their chart notes. You'll find out that there are so many things that are placed in that chart note. 7 pages now. Do we really need that? You have to be able to place different things in the chart note, things that you are doing in the room. This has to be accurate. But if you don't put those in, then you're not going to be able to bill appropriately. Does that make any sense? Another problem. What I charge is depending upon what your diagnosis is. If I remove a lesion from you, if that lesion that I remove off the skin, if that lesion happens to be malignant, or I think it's malignant, I can bill you more for the exact same procedure that I did to determine what it was to begin with. Does that make sense? What I charge for ear irrigation, washing your ears out, that actually can be just as much as me having an office visit where I discuss with you how we're going to work on your hypertension, high cholesterol, diabetes. Does that make sense? There are a lot of problems here. So how are we going to fix this? And my solution to this, I think, is going to be relatively simple. What we need to do is we need to focus on time-based medicine. Think of all the industries out there where you are billed according to time. Yeah. And so now when I'm in a patient's room, my documentation can be associated with exactly what I think is needed for that visit. What did the patient come in with? Their complaints. What are my thought processes after my examination on what's going on? Maybe there are no problems and we're just discussing, God forbid, end of life. Or maybe we're discussing colon cancer screening or breast cancer screening. It's time. Let's just say I remove a lesion. Does it matter if I'm removing a lesion that is malignant or if I'm removing a lesion that is benign? The procedure that I'm doing is the same for the initial diagnosis. We may have to have further follow-up. If it's malignant, we may have to do a different procedure. Or I may have decided that this is malignant and it's going to require a very extensive procedure. Maybe the surgeons are having to do a very complex surgery that's going to take a lot of time. Maybe a surgeon with that complicated procedure is going to have to see the patient more post-operative. They should be able to bill for that. That is their time. And it is not that way right now. And so it really doesn't matter what your diagnosis is. The diagnosis is not what is going to make us bill more. It's going to be time. Does that make sense? A little bit more sense with this. Well, oh brother, you're going to have those physicians that are going to say that they spent 45 minutes in a room and they only spent 5 minutes. How are you going to fix that? Got that answer. So what we need to do is we need to have at the end of the visit a signature at the bottom of the chart note. And that signature is going to be by the patient, by their medical power of attorney. And that is going to say, this is what was done today. They're going to look at the note that the doctor wrote or the note that the doctor printed from the computer. And they're going to say, yep, that's what was done. Yep, that's the amount of time that we spent, because it's going to be time-based. And so the physician is now going to have a little check and balance. They're going to realize that at the end of this visit, we are going to say, yep, that is what was done during this visit. We don't have to have third-party payers with insurance or Medicare or whatever that comes in and says, did you really do this? Is this what was done? You didn't diagnose and you didn't put this in the chart and you did. They weren't even there. They don't know. It needs to be associated with the doctor and the patient. And that is going to be a lot more accurate. So now we've got the patient and the doctor that are going to be involved in the bill. The other part of this one is now the doctor is able to spend time with the patient, listening to what they're saying, focusing on what they're saying, and they are able to spend more time with you, the patient, so that they can focus on diagnosis and treating. Because how many times am I in a room and I'm focusing on the computer and I'm focusing on, am I hitting the right points with billing, and have we clicked that we've looked at their medications, and we have to click reconcile at the bottom of their medication list, and if we don't click that little button, then that's a problem. Okay, how many times am I in a room thinking about all those things when I should be focused on the patient? And so if I have a more simplified way to bill this, a more simplified way to document this visit, I spend my time with the patient. And if I'm not spending my time with the patient trying to diagnose what is going on, that is a disservice to the patient. It may look good on paper, but who cares? And again, for all the critics out there, I understand. There's a lot of people who can say negative things. I encourage anyone to have any comments. On the people that are negative, I would say, what's your solution? And if your solution is better than mine, I'm all for it. We're here to help this country. If you're just sitting there just criticizing, that's easy. I want to thank you all for following me with these videos. I am hoping that a lot of people take some of these thoughts and run with it. I am here to help. Let's restore healthcare.